Imagine walking into your doctor's office, expecting a routine checkup. It's only to leave feeling more worried than when you came in. What if I told you that some tests many people over 70 get every year could actually do more harm than good? Today we're going to uncover 5 common health tests that might be unnecessary, risky, or even misleading after the age of 70, and what smarter, safer alternatives you should consider instead. By the end of this video, you'll have the knowledge to protect your health, avoid unnecessary anxiety, and make decisions that truly benefit your body. As we age, our bodies change, and so does the way we respond to medical tests. What was once considered a routine screening in your 50s or 60s might not be helpful anymore, and in some cases, it could actually lead to complications. For example, imaging scans can expose you to radiation. Blood tests can trigger unnecessary follow-ups. Certain procedures can lead to side effects that outweigh their potential benefits. This isn't fear-mongering. It's about understanding which tests are truly valuable and which ones may be best skipped. Let us start with the first test many seniors routinely get: the PSA blood test for prostate cancer. For men over 70, widespread research shows that PSA screening often leads to overdiagnosis. Many of these cancers grow so slowly that they would never cause problems in your lifetime. Yet a positive result can lead to biopsies, surgeries, and radiation treatments, all of which carry serious risks, like infection, incontinence, and sexual dysfunction. Instead of blindly getting tested every year, experts recommend discussing your personal risk factors and overall health with your doctor. Often, a watchful waiting approach or selective testing is safer and smarter. Next is the routine mammogram for breast cancer. Women over 70 are often encouraged to continue annual mammograms, but the benefit decreases with age. The likelihood of detecting a fast-growing, life-threatening cancer diminishes, while the risk of false positives and unnecessary biopsies rises. False positives can be stressful, painful, and costly, and sometimes they lead to procedures that have serious side effects. Instead, personalized screening based on your health history and life expectancy is often more appropriate. In some cases, spacing out mammograms or even stopping them may be the safer choice. Another common test is the bone density scan, or DEXA scan, for osteoporosis. While osteoporosis is a real concern for seniors, repeating bone density tests every year isn't always necessary. Once you're diagnosed and on treatment, frequent scans rarely change management, but they can cause worry and lead to overtreatment. Instead, spacing out scans to every 2 to 5 years, depending on your risk factors, is usually sufficient. Focus on lifestyle measures, like strength training, balance exercises, and adequate calcium and vitamin D intake, which have been proven to strengthen bones and reduce fracture risk. Blood sugar and cholesterol panels are also often performed annually. But for people over 70, aggressively chasing normal numbers can sometimes do more harm than good. Tight blood sugar control can increase the risk of dangerous low blood sugar episodes, and intense cholesterol-lowering treatments may lead to muscle pain or liver issues. Instead of routine yearly testing for everyone, doctors now recommend individualized plans based on your overall health, mobility, and the presence of other conditions. Sometimes less intensive monitoring is actually safer and just as effective. Finally, let's talk about heart screenings, like stress tests or advanced imaging for coronary artery disease. Many older adults are automatically sent for these tests, even if they have no symptoms. But research shows that in asymptomatic seniors, these screenings rarely prevent heart attacks, and can trigger invasive procedures like stenting or bypass surgery that carry significant risks. A more evidence-based approach focuses on managing risk factors like blood pressure, lifestyle, and medication adherence, rather than chasing test results that might not improve your long-term outcomes. The key message here is that routine doesn't always mean necessary. After 70, your medical care should focus on what truly benefits your health, quality of life, and independence. Unnecessary tests can lead to stress, complications, and treatments that may not even extend your life. Instead, prioritize conversations with your doctor about what screenings are actually meaningful for you, based on your personal health, mobility, and life goals. Now, you might be wondering, if some of these tests aren't always helpful, what should you do instead? The first step is shifting from a one-size-fits-all approach to personalized care. This means looking at your overall health, your daily functioning, and your personal priorities, rather than automatically following a checklist of screenings. For example, if you're active, eat well, and have no significant family history of certain cancers, some of the routine tests may offer little benefit and more potential harm. A practical approach is to focus on preventative measures that truly make a difference. Simple habits like walking daily, doing balance and strength exercises, eating nutrient-rich foods, staying socially connected, keeping up with vaccinations, have a much greater impact on your health and longevity than repeated unnecessary tests. These actions reduce the risk of falls, heart disease, cognitive decline issues that matter more than detecting a slow-growing asymptomatic cancer that may never affect your life. Another important aspect is understanding the risks associated with over-testing. Every test, no matter how routine, carries the possibility of false positives, leading to anxiety, additional procedures, and side effects. Imaging scans expose you to radiation, biopsies can cause infections, medications started after borderline test results can create new problems. In short, more testing isn't always better. It's about smarter testing, tailored to your body and your life. Communication with your doctor is crucial. Ask questions like, what is the chance this test will change my treatment? Or are there safer alternatives? This empowers you to make decisions based on real benefits rather than habit or fear. Many doctors now embrace shared decision-making, weighing the pros and cons with you, instead of automatically ordering annual tests. Finally, embrace the mindset that health is more than numbers on a test report. Maintaining independence, mobility, mental sharpness, and energy levels are far more meaningful measures of well-being after 70. By prioritizing lifestyle, selective testing, and informed medical decisions, you can protect yourself from unnecessary harm while still staying on top of your health. Let's take a closer look at how to apply this in real life. Imagine scheduling your next checkup. Instead of asking for every routine test, come prepared with a list of your goals and concerns. Maybe you want to avoid falls, maintain your energy, or keep your memory sharp. Share these priorities with your doctor. Together, you can decide which tests truly support those goals and which ones may safely be skipped. For example, instead of an automatic annual PSA or mammogram, your doctor might suggest monitoring symptoms, periodic blood work, or imaging only if there's a specific concern. Instead of yearly bone density scans, they might recommend exercise routines, nutrition adjustments, or a scan every few years. The shift is from testing for the sake of testing to testing with a clear purpose, tests that inform meaningful decisions about your health, not just numbers on a chart. Lifestyle remains the cornerstone of healthy aging. Strength training, flexibility exercises, and balance activities are particularly powerful. Evidence from studies around the world shows that these practices reduce the risk of falls, fractures, and even cognitive decline. Nutritional choices like eating plenty of vegetables, lean proteins, and healthy fats support heart, brain, and bone health. Adequate hydration, sleep, and social engagement all play a role too. These aren't glamorous or high-tech interventions, but they are highly effective. It's also essential to remember the psychological benefits of avoiding unnecessary tests. False alarms can create anxiety, disrupt sleep, and impact mood. By reducing tests that aren't likely to help, you reduce stress and can focus on the aspects of life that truly matter, enjoying time with family, pursuing hobbies, staying active, and maintaining independence. Finally, one of the most empowering steps you can take is education. Learn about the tests you're offered, their potential benefits, and their risks. Reliable sources, including medical organizations, peer-reviewed studies, and discussions with your physician, can help you make informed decisions. Knowledge transforms fear into confidence, allowing you to take charge of your health in a way that's safe, effective, and aligned with your life priorities. As we wrap up the main discussion, it's worth emphasizing one last point. Age alone shouldn't dictate your medical care. Two people who are 72 can have vastly different health profiles, energy levels, and life goals. That's why individualized care is the key. Instead of following rigid routines or feeling pressured to undergo every screening, your choices should be guided by what truly benefits your body and quality of life. Think of your health like gardening. Some plants need daily watering, while others thrive with occasional care. Overwatering can harm what you're trying to nurture. Similarly, Overtesting can strain your body, mind, and resources without offering meaningful benefit. The goal is to cultivate wellness, wisely focusing on nutrition, movement, mental stimulation, and safe, selective medical care. Another practical tip is to maintain an open dialogue with your healthcare providers. Don't hesitate to ask why a test is recommended, how the results would influence your care, and whether there are safer or more effective alternatives. Many doctors appreciate patients who ask thoughtful questions, and this shared decision-making often leads to better outcomes and peace of mind. Finally, remember that small, consistent actions often outweigh frequent tests. Walking, stretching, strength exercises, eating balanced meals, staying socially engaged, and managing stress all contribute to longevity and quality of life far more than repeated screenings that may not be necessary. Your health after 70 is less about chasing numbers and more about supporting your body in ways that truly matter, maintaining independence, vitality, and joy. In conclusion, after 70, not every routine test is automatically beneficial. Some can create unnecessary stress, trigger harmful procedures, or offer little real value for your health. The key is to focus on what truly matters, protecting your independence, maintaining strength and mobility, and prioritizing lifestyle habits that support long-term well-being. Smart, selective testing, guided by your personal health, risk factors, and life goals combined with exercise. Proper nutrition, social engagement, and mental stimulation is far more powerful than blindly following routine checkups. By understanding the risks and benefits of each test, asking informed questions, and working closely with your doctor, you take control of your health in a way that's safe, practical, and tailored to your life. Your goal after 70 isn't just to add years to life, to add life to your years. Avoid unnecessary tests. Focus on meaningful health actions. And embrace choices that help you stay active, independent, and vibrant. This approach empowers you to live fully, confidently, and safely, without the hidden risks that come from tests that may do more harm than good.